Welcome back. You're watching Morning Cafe. Thank you so much for staying with us. And this morning, this moment, you're talking about oral healthcare, especially in pregnancy. I understand that this is something that is often overlooked. And Dr. PJ Muriuki, Director, Dental Services, Nairobi County, is here to help us understand why is it actually important to take care of your oral health while pregnant. Karibu sana Daktari to studio. How are you this morning?
Thank you very much, Anne, for having me. And good morning, viewers. I'm happy to be here. This is the first show you're having this year, so I'm excited as we continue this journey of demystifying dentistry.
Yes. So maybe you could set the stage for us. Why is it very important to also focus on oral health care during pregnancy? You see, this is something that we don't talk much about.
Yeah.
There's a lot of myths and misconceptions surrounding this topic and this conversation. Why is it important?
No, it is important, actually, not only for pregnant women, but for everyone to look after their oral health. We normally say that the mouth is the window of the body, and we cannot talk about the general wellness of the body without talking about oral health. So around pregnancy, there are usually, like you said, a lot of myths of what to do, what not to do, and that is why we are here, so that we continue demystifying some of these myths, because, you know, they say a lie or a myth will have gone halfway around the world before the truth can even tie the shoelaces. So we want to continue to empower our patients, our clients, so that they are able to know the truth and actually know how to take care of their oral health. Yes.
Even when you say that it is important for everyone to take care of their oral health, you know, we are told that in schools, puberty class 3, class 4, you're taught, lower class, basically, you're taught about these things. But I understand that during pregnancy, this is a very sensitive time for the mother, not only the mom, but the child. But why is it very sensitive for the pregnant woman?
Yeah, it is because, during this stage, the body is undergoing a lot of changes, all right? The pregnant lady or the woman, there are so many changes that are happening around the body. And, this definitely will affect the oral health of the dental health of this woman. And also, remember, it's not just about the woman, but also the baby they are carrying. There are some things that they can do. There are some things, for example, medication that they can take that will affect the baby. There are things like water. If a pregnant woman consumes water that has high fluoride, then the baby teeth of this unborn child will get affected. And I don't know whether you know this, but teeth formation starts in the first trimester, right? So that's when the baby teeth start forming in the body. So, and the nutrition of this baby...
First trimester ni gani?
First trimester is the first 3 months, yes,
okay,
of pregnancy, right? That is when most of the organs are forming. It's called organogenesis, and teeth are part of what is forming. And as you know, during the formation of teeth or any other organ, the baby gets nutrition from the mother. So there are some things that the mother can take that will affect the teeth of this unborn child. And that is why you find that some babies are born and immediately they are born and the teeth that are coming out are not looking normal. They are chalky white in color, or sometimes they can be discolored, they can be brown. And it could be just because of what the mother did. And that is why this conversation is very important, not only for the mother, but also for the unborn baby. Yes.
So what should a pregnant woman do to ensure that the baby is not affected? Now, they don't.
Yes.
Let's talk about the don'ts first.
Yes. All right. So for the don'ts, of course, number one, there are some medication that you are not supposed to take when you are pregnant. All right. So some of this medication include some antibiotics like tetracycline. So if a pregnant lady takes tetracycline, which is an antibiotic, then this will affect the formation of the teeth. And the baby will get stained teeth. They are called tetracycline stains. And these are permanent stains on the teeth. So it is important that, for example, you avoid or consult your doctor before taking any of this medication. Because, Kenyans, we are very fond of doing over-the-counter medication, right?
Yes.
So you just feel you have a cold, you go and say, nipatie antibiotic, whatever, Then this can severely affect even the baby. Then there are some things like even being careful about the water that you take. as you know, there is a huge problem with what we call dental fluorosis or discoloration of teeth. You know, dental fluorosis affects you from the time you're in your mother's womb all the way to around 8 years. So it means that if a pregnant lady takes water that has high fluoride level, the normal fluoride level should be 0.5 milligrams per liter, right? So anything above that means that the fluoride is very high. Now, if this fluoride is taken in by this pregnant woman and you know, it's in high content, then it will affect the formation of the teeth and the teeth will come out discolored. And most of the time you find that this water is usually from boreholes. And we know nowadays everywhere people are sinking boreholes. So it is important that you know, you be careful and test the water that you are taking, especially if you are using borehole water. Yes.
You see, we see people with, of course, discolored teeth.
Yeah.
So now you're saying that sometimes it's what the mother does.
Yes.
Ekwangi from a certain region where it's known that this region, let's say for example Nakuru, I know Nakuru.
Yeah.
Sana, you know, people from that side, and no offense to them,
Yes.
most of them have discolored teeth.
Yes.
So usually what I'm getting from you is that it's what the mother does, and being that inatoka from a region is a myth and not true.
Yeah. I would say it's not the factual position right now. In fact, there has been a shift over the last decade.
Yeah.
Like you said, it used to happen along the Great Rift Valley, Nakuru, Naivasha, and Baringo, and such areas. But right now, let me shock you, it is more in Nairobi. Yeah, it's more in Nairobi because what has happened is over the last 10 years, there has been a burst of you know, developments, especially to do with housing. And unfortunately, we've not had enough water for these households. So you find that most of these people who are building, you know, their own houses, their apartments, you know, they don't have good supply of water, you know, and therefore they look for supplementary water, mostly from boreholes. And unfortunately, the aquifers that we have underground there, they have very high fluoride content. So you find that most of the kids that we are seeing, there was a research by the Ministry of Health, it's called the Kenya National Oral Health Survey. It showed 1 in every 2 children now has dental fluorosis or discoloration of the teeth. And mostly you find it is not from the poor neighborhoods, it's actually from the affluent neighborhoods. Why? Because these are the people who are able to dig boreholes. You know, when they don't get enough water, they dig boreholes, and unfortunately they don't test or put measures to make sure that the fluoride level is filtered. But the people in the, you know, in the ghettos, if I may call them that way, you find they know water comes on a Monday and a Saturday. So they'll wait for the water, store in jerry cans. So mostly you find they don't use the borehole waters. You look at the schools nowadays, where we are taking our kids, most of these schools also have boreholes. So that's why we are saying the issue of discoloration of teeth, what we call dental fluorosis, is more common in the Nairobi metropolitan area because of, you know, the way we are sinking boreholes. Yes.
Things are changing, and this is very crazy. Genes, matter, pia kwa meno. Anyway, interact with us on our social media platforms at TV47 Kenya on Facebook and YouTube, TV47 News KE on X, and call us. The number is on the screen. Send in your questions. Dr. is here to answer them. Now, Dr., what are the common health issues that, oral health issues that pregnant women face? All
right. So now, like I say, during the pregnancy period, there are a lot of changes that usually happen in the woman's body. And you find that there is even a myth of, not really a myth, it's I'd call it a misconception, where people say that, you know, when I was having my firstborn, I lost this tooth. And the secondborn, I lost this other tooth. So they attribute it to, you know, they have to lose a tooth during a pregnancy, apparently because of calcium. So it is actually a myth, all right? Because that is not the truth. So what happens during pregnancy, there are 3 things that usually happen. Number 1, there is the hormonal changes. There is usually a surge of estrogen and progesterone during pregnancy. And these 2 hormones, what they do is they also make the body or the environment even in the mouth to change. As you know, the mouth has a lot of bacteria. Some of these now good bacteria, because of the change in the environment in the mouth, you find that they turn to become harmful bacteria. So, and these are the ones that
there's good bacteria and bad bacteria?
Yeah, I mean, we have what we call a mutual symbiotic relationship with the bacteria. We have millions of bacteria. So long as they're in the right environment, they benefit us and they also benefit from us, all right? But now when there is the environmental change, that is the mouth, you know, because of the hormonal imbalance and all those things, the environment in the mouth changes. You find that this bacteria now starts attacking the teeth. And that's when you get that during pregnancy, you can easily have gum disease, right? And this gum disease, mostly because of, you know, this bacteria that have become harmful, also the change of environment. Also, let's remember that during pregnancy, there is a change in, you know, feeding habits. You find that some ladies want to, you know, eat, you know, sweet things or sour things, others crushed stones, you know, and all those things. There are others who have to eat a chocolate before they sleep, you know. So again, sugary things, we all know that that contributes to cavities, right? So, and now you have the change of environment, you have the nutritional change, right? These two combined will definitely cause havoc in the mouth. And that is why you are more susceptible to get gum disease or to get cavities when you are pregnant, right? So this is the reason why you'll find that most pregnant ladies will have issues with their teeth. Because even brushing, remember, you know, we normally say you have to brush your teeth to keep them healthy.
Yeah.
So during pregnancy, especially the first trimester, there are ladies who are also vomiting a lot, you know. Remember, the vomiters is coming from the stomach, and it's usually acidic. So this acid will burn the teeth, and this will, you know, increase the chances of a cavity forming. Again, brushing, most of them don't brush. Why? Because they feel irritated by, you know, the brush. They feel like they want to puke. So all these factors, the hormonal imbalance, you know, the change in feeding habits and snacking habits, you know, the vomiting that they have, and the poor oral hygiene because they're not able to brush, contribute to them getting more problems during pregnancy. So, and therefore, if you do not take good care and consult your dentist, then there's a likelihood that you will get cavities, you will get gum disease, and if not careful, you might end up losing a tooth. So it's not because of the calcium. It is just because of those things that we've talked about.
Now, is there an option for these ones who are puking when they take that gargle, you know, and they feel this urge to puke? Is there an option for them? Because you see, it can't be avoided. It's something that is inside. So what can they do? Because lazima brush meno anyway.
Yeah, so what we normally recommend is, like we said, whatever is coming from the stomach is usually acidic. So it will burn the teeth, all right? So you should not brush immediately. Because basically, if you brush immediately, you're brushing your teeth with an acid, right? So you're scrubbing now those teeth. You are activating the acid. So what we normally say is you wait at least for 30 minutes before brushing, all right? And after every episode of, you know, puking or vomiting, you at least rinse your mouth with water. Just get water, rinse it out because it dilutes the acid in the mouth, all right? If you're able to access bicarbonate, you can get bicarbonate put in water and just rinse to neutralize the acidity in the mouth, right? Then, you know, just try as much as possible to brush. If you're not able to use the normal toothpaste and toothbrush, you can even get a twig, you know, ile mswaki, you know, just do whatever, do something that needs, whatever you need to do to at least disrupt the formation of plaque, because plaque, that is a food debris, when they are also left in the mouth, change the environment, the same thing. Change the environment becomes acidic, the bacteria start becoming harmful, and all that now will lead to your teeth getting damaged. Mm-hmm.
You also brought in this aspect of cravings. Cravings are cravings. She could crave chocolates, the 2 bars at the same time. But now how do we strike a balance between these two? Because she can't ignore these cravings, and also she has to take care of her teeth.
So the thing is, you know, you can't change you know, nature. Like, you know, if you are craving for something, it's only good that you have it. But now, the reason why we're here is to impact the knowledge that those cravings sometimes can also cause havoc on your teeth. So what we need to do is either, number one, we try to snack during mealtime, so that you're able to brush immediately. Or number two, you just try, immediately you take a snack, all right? Just know that now, because you've also changed your snacking habits and eating habits, you can't rely on the once or twice a day brushing. So you need to brush more. So you compensate that also with the brushing, because you're now snacking a lot, then now you need to brush more. Because it's not about the snack, you know, ideally the snack is supposed to go down your body and stuff like that.
Yeah.
But the debris that is left in the mouth, so that is what you want to disrupt, because then it's going to cause us to have gum disease, cavities, and such like things. Yes.
You mentioned something, this stone, the white one, you know, and you see, is it an insect that in a forms something on the wall?
Yeah.
You know, pregnant mothers.
Termites.
Termites.
Yes.
Pregnant mothers love that.
Yeah.
Do they really have a negative effect on the tooth? Because that's how, you know, most Kenyans really love eating that, the white stones and these white termites, whatever the white termites in a form apple.
Yeah.
What is the effect of that?
No, I mean, like we said, you can't stop them from craving, and they have.
Ni kama sukari? Do they have sugar in them?
Yeah, I mean, it's not about
the sugar.
You see, like the stone,
Yeah.
what you're doing is now you're misusing your teeth, because you are crushing things that are too hard, you know. So you might end up with fractures of the teeth and stuff like that. Okay. So, and like we said, all we need to do is compensate with brushing. Actually, overcompensate. Just make sure that you're brushing, and also brush in the right way. I think we were here last year and we showed people how to do proper brushing, right? So once they do that, then they don't need to worry. Then number two, also visiting the dentist. There's this myth, and I'm sure your viewers will ask about it, you know, saying, oh, I was told because I'm pregnant, I cannot see a dentist, right? Or, you know, I'm in pain, my tooth is paining, I was told I wait until I deliver. You know? Yeah. So all those things are myths that need to be, you know, demystified. Yes.
So how can we differentiate between normal pregnancy symptoms and serious health issues, oral health issues?
Right. So mostly the symptoms of oral health issues come with pain. So the most common thing that a pregnant woman would feel is all of a sudden they have a toothache, right? Toothache is number one. So you find that because of the reasons that we've given, that the teeth are more susceptible to getting cavities. They'll get a cavity. When the cavity gets to the nerve, then they start feeling pain, and now they present with pain. So should they get pain, please just know that you can visit a dentist and have a procedure done when you're pregnant. So this myth of that you cannot visit a dentist is not true. And what we normally say is, of course, every pregnancy is different, and you will deal with the patient. I like saying that a good dentist does not treat a tooth, right? A good dentist treats a patient who has a tooth problem, right? So those are two different things, because in the latter, what is happening is you will evaluate your patient, and then depending with the symptoms and whatever they are presenting with, you will know the best way of dealing with it, right? So if they have pain, they visit the dentist, let them avoid over-the-counter medication, because again, some of this medication is harmful to the baby, right? So people will go and take maramoja and all those paracetamol and all those things. They are harmful to the baby. Because like, for example, if someone is in the third trimester, ile ya mwisho, you know, the last 3 months, if you take some of these painkillers, they can even make the baby to have what we call a hole in the heart, ductus arteriosus. So there is a hole that is supposed to close just before the baby is born, right? If you continue taking painkillers because you're pregnant, you don't want to go to the dentist, you know, what will happen is it will now affect your baby, and they can even be born with a hole in the heart or other conditions, all right? So that's number one, pain. Number two, bleeding gums. So bleeding gums are very, very common during pregnancy. And what is the reason? Again, like I said, hormonal imbalance. There's a surge in estrogen, there's a surge in progesterone, all right? And also the poor oral hygiene. So that makes the gum to be reddish. So every time you brush, you find that you're spitting blood. In some severe cases, you can even have what we call pregnancy tumors, right, on the gum. So you find that one part of the gum is really swollen. It's like a ball. you know. Most of these things, again, you just need to go to a dentist to have them checked out, but there is nothing to worry about, right? Because it's just a face. And, you know, with proper oral hygiene and with proper treatment by the dentist, it should be okay, right? So those two are the main common issues that you will get, symptoms that you'll get during pregnancy. Swellings, cavities that will present with pain, and also bleeding gums. Yes.
How about the sensitivity? Because I've had other women saying meno inatetemeka.
Yeah.
How about that?
Yeah, so, you know, the tooth is usually anchored inside the bone, and the bone is covered by the gum. So when you have what we call pregnancy gingivitis, gingivitis is inflammation of the gum. So when you have pregnancy gingivitis because of the hormonal imbalance, what happens is even the foundation of the tooth is affected. So that's what we call gum disease. The problem is not the tooth, but the gum, you know, the support structure of the tooth is affected by what we are calling gingivitis or periodontal disease. But also there is sensitivity because of too much vomiting, right? So remember we said sometimes when you are vomiting too much, the acidic substance will come and burn the teeth. So the protective layer that is the enamel on the tooth gets demineralized, or it gets inakuwa ndogo. So anything hot, anything cold, you start feeling sensitivity. And sometimes even just walking around, upepo ipite unasikia tu sensitivity. So it could be because of, you know, the damage of the outer protective layer of the tooth. Yes.
Does it happen to all pregnant women? Hiyo kutetemeka kwa meno?
Not all of them, but it's a common symptom.
Yeah.
Because, you know, and you know, there are ladies who have you know, a very good time. They have bliss in pregnancy. Like,
yes.
they have none of those issues at all. They don't have cravings. They don't have vomiting. So, of course, those ones you'll expect they'll not have so much changes in their oral health. But there are those others who, you know, have a very bad time during pregnancy, especially the first trimester. Even as, you know, any smell, any taste, you know, they want to vomit. So those ones, by the end of that pregnancy, definitely their teeth will have taken a hit, and generally their oral health. And that is why we encourage, actually in some countries, visiting the dentist is part of, you know, the...
Insurance?
No. It's actually part of the routine as you're preparing to get pregnant. So you get your oral health sorted and everything before you now conceive. But now, is that implementable in our country? I don't think so. So what we need to do is, even when you're pregnant, if you have an issue, the rallying call is visit a dentist, and make sure that whoever you're visiting is a qualified dentist. Because again, we have so many quacks out in the streets. They need to go to a properly qualified dentist. And especially like for us in Nairobi County, we have a lot of public facilities that they can go to. I lead a team of about 50 dentists that are spread around all the public facilities, Mama Lucy, Mbagathi, Pumwani. Actually, in Pumwani, we have a mother and child dental clinic. So that is specifically for, you know, the pregnant ladies, you know, their babies and all that time, and they should be able to be taken care of. Yes.
I mentioned something about insurance, and, you know, I read somewhere that there are other countries where, you know, when they're going for treatments, these mothers, or just routine checkups, they have an insurance cover that caters for their oral health. Do we have that in Kenya or in Nairobi, now that you lead a team in Nairobi?
Let me take a sip. So this is a big thing because, you know, we are rolling out SHA. And unfortunately, dental is not covered in SHA.
Why is that so?
I don't have the answers for that, but it's really unfortunate. I think they're saying it's going to be rolled out later.
Okay.
But it's unfortunate in this way, because when we are talking about nutrition, you know, the wellness of a person begins with nutrition. So you eat right, you know, then your body is most likely going to be okay. Now, if we look at nutrition, where does nutrition start? Again, we go back to our primary school, class 4. We are told digestion starts in the mouth, right? So if you have good oral health, you are not in pain, your teeth are okay, your gums are okay. What that means is you are able to take your food well. But if you have issues with your teeth, then you're not able to have good nutrition, right? And that definitely is going to affect the whole of the body, because nutrition begins in the mouth. So kama unaenda hospitali unaambia ukule nyama na una meno, utakula nyama aje? You know, how will you be able to eat your food and enjoy your food when you're having a lot of pain or sensitivity in the mouth? So it is, I think it was an oversight not to have dental covered in SHA. But nonetheless, the good thing is for us in Nairobi County, our governor has made the services really subsidized. Actually, in our level 2 and 3 facilities, the services are free, all right? So for example, we have a facility called Lady Northie, just here on State House Road. It's specifically, actually it's the only dental clinic in East and Central Africa that is specialized for pediatric dentistry, all right, purely. So they go there, they get treatment for free, right? So you don't need to have an insurance for your baby to be sorted. You look at other hospitals like Mama Lucy, Mbagathi, Pumwani, all of them, they have fully fledged dental clinics. Some of them even have 10 dental units, you can imagine. Very nicely done, like private hospitals. So, and we have qualified staff. Again, the services are very subsidized. For a service that, for example, you'd do at 10,000 in a private hospital, and it's 1,000, right? So it is accessible. So access is what we are trying to increase to make sure that, you know, we get to every other person, but at least there is something, even as we wait for insurance to, especially the SHA to take effect, there is something that can be done. People are not left to their own devices. Yes.
We'll be here. We'll be here to see that if it actually happens for these moms. And when you talk about ensuring that the baby's oral health is also safe, we are talking about babies. Are we talking about babies who, wale wana meno, easy checkups? Do they start from that point, or when they start teething? When does it start?
So we normally say, and it's a good question, because we are talking about, you know, mothers and the babies.
Yes.
Immediately a baby is born, that is when they, you know, the first day, that's when they're supposed to brush.
What do they use to brush?
Right.
Because the gums.
Yeah. So first of all, most of them don't have teeth, right?
Yeah.
So what you're supposed to do is you are supposed to wipe those gum pads, especially after breastfeeding. So all this does is you just take a cloth, you just clean cloth, water, warm water, and just start wiping the gum pads. What this does is it makes them used to that action of them being, you know, brushed. So therefore, when the first tooth comes into the mouth, again, you should continue wiping those teeth, especially after breastfeeding. I usually see a lot of mothers coming and telling me, my baby alizaliwa na meno mzuri, sasa zimeanza kuchipuka. And you find that, you know, it's just because of the milk. Some of these babies cannot sleep without, you know, either a baby bottle or breastfeeding or actually breastfeeding. So this milk, just before they sleep, is usually left in the mouth, right? And the breast milk has a lot of sugars. So if these sugars are left in contact with these teeth for a very long time, this is actually what affects the teeth. And you start getting those babies with cavities, and they are very, very young. So the advice to the mother is gum pads should be wiped. The tooth comes into the mouth, wipe it, especially at night before sleeping. If you can be able to avoid the baby sleeping with, you know, your munyonyi and also, you know, the breast in the mouth, that would be good, because then you'll avoid hiyo sukari ya maziwa kufanya hiyo meno ipate mashimo, right? Then we normally say, visit the dentist during by their first birthday, they just go to the dentist. You know, in Kenya we have a problem of visiting the dentist only when in pain. Ukienda hapo utaambiwa venye utabrush huyo mtoto wako, kama kuna shida, it's discovered early. You just get the advice that you need. So first birthday, you have to visit the dentist. Yes.
All right. Yenye, they say every day is a learning day.
Yeah.
And I didn't know that part of, you know, wiping the gums as well.
Yes.
And we have a question for you, Dr. Alice from Kawangware is asking, can dental infections during pregnancy harm the baby?
All right. So that's a good question. Like we said, because of all this, the 4 factors that we talked about, the hormonal imbalance, the change in habits, you know, the vomiting and all those things, you are also susceptible to these infections. And these infections, because again of the changes in the body, something that ordinarily would not be big, small infection, can blow up to be a very big infection. You can, for example, have a toothache. As a normal person, you just take medication or you go and have it sorted out and you're okay. But because now the body is not in a normal state, pregnancy is not a normal state. Yeah, you find that small things get blown out of proportion. So you might find you start with a toothache today, you get an infection, and that infection blows up and becomes even systemic. Systemic means inateremka, inaingia hadi kwa damu. Alright? Inaingia kwa damu na naona sasa damu inasakileta hadi kwa mtoto. So inaweza affect mtoto. Or even now yourself, you find that you get a severe infection, what we call septicemia, which is again dangerous to you and the baby. So if you have any issues, you need to go early. So huwezi kaa nyumbani ugoje, even swellings, you find that something that ordinarily would not have given you a swelling, you end up with a huge swelling, and which again is very dangerous. There is a condition called Ludwig's angina. It's where the infection, you have an infected tooth, inafura, alafu infection inashuka huku chini, inaenda mpaka kwa chest. So, and inaweza, it can actually constrain the windpipe, ile ya kubreathe. So unaweza pata, if you are not attended to, because ni pass, if you are not attended to within 24 hours, you might even lose the mother. So it is that serious. So that's why we are here, to make sure that our patients are well informed and they know these things, because information is power. Yes.
Remember to send in your questions. We're learning here. And this one says, hey, I'm watching from Nyeri Mweni. Can untreated dental issues during pregnancy affect the baby's teeth later on?
Yeah, so I didn't get the question right. Is it untreated dental?
Untreated dental issues,
yes,
during pregnancy,
yeah,
can it affect the baby's teeth later?
Not directly, but of course, if you have untreated issues in the mouth, it would also mean also your nutrition is not good, because you're not able to eat properly. For example, if you have a toothache, if it's not treated, it means that side hautakuwa unakula, kuna vitu huwezi kula. So therefore you find that nutrition-wise, you will not do very well, and this might affect the baby. So as much as it will not affect the baby directly, there is an indirect link that can cause problems to the baby. Yes.
Awesome. Jen from Kajiado is asking, can pregnant women undergo dental cleanings or fillings?
Yeah, good question. Like we said, it's a myth that, especially in, some of these informal settlements, you hear, mimi niko na mimba sasa, naumwa na meno sana, lakini niliambiwa siwezi enda mpaka nipate mtoto. That is not true. Actually, I don't know whether, Anne, you've ever had a toothache.
You cannot sleep with that.
Cannot sleep. So you can imagine, this is a lady who's dealing with a lot of issues, right? The pregnancy and all the things that come with it. And again, they're having a toothache. So, and then you're telling them to wait until they deliver. Then what will they be doing in the meantime? They'll be taking medication. This medication, like we said, will affect the baby. So it is very important for people to know that when you are pregnant, you can have a filling done. What we avoid is unnecessary procedures. Huwezi kuja uniambie nikufanya whitening. Hiyo nitakwambia hauko serious, just ngojea mpaka, the pregnancy is. But if you are in pain, there is something that we can be able to do. Even root canals, we can do root canals when you're pregnant, because then that takes care of the pain. Because remember, this pain can even cause a miscarriage, because it's usually very severe. Some of this medication that you take to subside the pain can affect even that pregnancy. So the better devil here is to have the treatment done. And we normally encourage treatment during the second trimester. Second trimester ni kutoka miezi 3 mpaka miezi 6. Kwa nini? Hii miezi ya kwanza, the first trimester, unapata the lady ndio ana deal na a lot of issues, kutapika nini. So hata ukiweka machine kwa mdomo, anaanza kufeel kama anataka kutapika. So we don't encourage during the first trimester. Lakini ya katikati, most of the ladies usually wako sawa, right? So during that time, the pregnancy is not very big. And again, they are not dealing with the issues of first trimester, kutapika, nausea, and all those things. So that particular period, you're able to do some of those emergency or necessary dental procedures. But like I said, again, it is not the same for everyone. Kuna wengine wako na pressure, wengine wako na diabetes and all those things. So the dentist, that's why I said the dentist should treat a patient who has a teeth problem, not that tooth. Because there are patients that will not be able to do a root canal, for example, and they're in that second trimester. So it's on a case-to-case basis, and that is for the doctor to call. Again, during the third trimester, we avoid. Why? Because the pregnancy is very big, right? It's advanced.
Yeah.
So what happens is, unapata sasa mama ni mzito sana. Na if you've ever been to a dentist, unajua hiyo kiti yetu inalalanga. So akilala hivi, the baby will compress on some vital structures, you know, kama abdominal aorta, na anaweza hata faint. Okay?
The baby or the mother?
The mother, of course. The mother, of course.
Babies don't faint.
I'm not a gynecologist, but I would assume not. I'd assume not, yeah. But of course, because of that pressure to some vital structures like the abdominal aorta, so sometimes they feel like, you know, dizziness, and they feel like they can faint. So it doesn't mean that it cannot be done, but preferred time is second trimester. That trimester pia inaweza fanywa, lakini sasa kuna venye tutamposition. Hatuwezi mweka in a certain position kwa sababu inaweza affect the mother.
And you know, I was wondering, you see, for routine checkups, for those of us who are not pregnant, it's usually 3 months, right? For these mothers, so umesema they don't need to come at all every 3 months for checkup during their pregnancy period?
No, they need to. Actually, during the phase of the pregnancy, you should at least visit a dentist. So sasa akikuona, that is when they'll determine whether you need to see them again. So there are those ones who will just be given what we call oral health instructions, what to do. And there are others who have issues, and therefore they'll be given appointments so that they sort those issues before they deliver. Yeah.
You have another question here. Jambo, kuna specific dietary recommendations for maintaining oral health during pregnancy? That is Gloria from Kasarani.
Yeah, that's a good question. It's just basically what we say, a healthy diet. You know, a healthy diet that is well balanced, because again, you're not just eating for yourself. It is for you and the baby, right? Then we avoid having a sweet tooth if we can. Yeah, so sugary things, too much of it is not good. Of course, you are allowed to snack here and there, but then don't overdo. Yes, so just healthy food, proteins, carbohydrates, vegetables, yeah, and yeah, you should be fine.
All right. Are there specific toothpaste or mouthwashes recommended for pregnant women?
Not really. I normally like saying a toothpaste is like soap. Yeah. So what matters is whether you know how to clean your clothes. So it doesn't matter which soap you use. If you don't know how to clean your clothes, then you'll not be able to do a good job. The same thing. Toothpaste is just an agent for cleaning. The most important thing is how you do it. And I want to refer people to the video that I think we did sometime last year. We showed them how to brush. So it's about the technique. Number 2, the brush. And this brush, by the way, should be changed every 3 months. At least every 3 months. Or when you see the bristles are starting to fail. Then again, the toothbrush that we recommend is medium. So if you look at the toothbrush on the package, there's usually medium, soft, and hard. Most people like using hard. Ndio wasikie meno imekuwa safi. You know? And there are some people who scrub those teeth like they are scrubbing the floor.
Yeah.
You are in the sitting room, they're in the bathroom, you can hear. You know? That is again wrong, because using the wrong technique will make your gum to start receding. Unapata gum inaanza kupanda because unatumia nguvu sana. So there is a technique of how you're supposed to brush. Yeah.
Some of us don't even know there's the small, the medium, and the hard whatever.
Yes.
Yeah, so how do we really identify them? Even for pregnant women alone, or everyone?
No, everyone. So we recommend a medium toothbrush. Again, you visit your dentist, you know, people are different. But we generally, as a rule of thumb, a medium toothbrush should be okay. Toothpaste, just use what we call fluoridated toothpaste. There's usually this myth of people saying, oh, staki kutumia fluoride and all those. So I normally say, and I think I said it here before, fluoride is an angel when used topically. Topically meaning unaitumia kwa meno.
Yeah.
But then it becomes a devil when you swallow it. right? So that's why we are saying water with high fluoride, juu unakunywa hiyo maji ama unapika na hiyo maji ikiingia kwa system, sasa hiyo ndio mbaya, right? Lakini kama ni kutumia kubrush and then you spit it out, it is very good because it protects the teeth from getting cavities. So unaangalia hiyo toothpaste kama imeandikwa fluoridated toothpaste. So that is what we recommend.
All right.
And then for the babies, again, hiyo toothpaste ufai kutumia mingi. There are people who put ati yote kwa brush mzima. Hapana, inahitaji tu kidogo. Just kidogo, especially for babies, inafaa kuwa pea size. Just like a pea, kidogo tu. Alafu unamu-encourage a spit. Because if, again, they swallow, what happens is hiyo fluoride ikiingia kwa system pia itaweza kuaffect meno yake. Na meno ianze kukua brown. Yeah.
Electric toothbrushes sasa, do they have any negative effect on moms? Or even babies?
Not really. Actually, they are good. But then again, you need to know how to use them. Because kitumia vibaya, kumbuka ina rotate. So kama ina rotate, inaweza umiza gum na gum zianze kurecede. But if you use it nicely, it's actually very efficient. It's able to reach areas where you ordinarily would not have reached with your normal toothbrush.
There's another question for you. And he says, hey, TV47 asked Daktari, does hormonal change during pregnancy affect oral health?
Yes, and I think we've talked about it. We've talked about the surge in the pregnancy hormones, estrogen, progesterone. So all those things will change the environment in the mouth, and therefore the bacteria will start becoming harmful, and they can cause a lot of that. And again, those hormonal imbalance will most of the time cause what we call pregnancy gingivitis. Gingivitis is a big name for inflammation of the gum ama gum kufura. Na hiyo symptoms inakujanga na kubleed. Ukibrush una bleed.
Catherine is asking from Kitengela, pregnancy inaweza cause teeth to loosen or fall out?
Yes. So again, what we said, the 4 factors we talked about, when they coalesce, gum disease is now what makes the tooth to fall out. So remember, like we said, the tooth is anchored in the bone, which is surrounded by the gum. So if there is issues with the gum, the tooth becomes loose, alafu inatoka. Kuna watu wengine wanakuja kama imeshika kwa mkono. So that is what we call gum disease or periodontal disease.
I want us to talk about solutions. What should pregnant women do daily to protect their oral health care? I know we've mentioned, what is it? Compensation.
Yes.
Yeah, you said compensation, for example, like satisfy these cravings that are nayo. So aside from that, what should they do on a daily basis to protect their oral health?
4 things. Number 1, making sure that they observe very strict brushing routine and use the right brush, the right technique just to protect their teeth. Because what brushing does, it removes all the dirt, because the dirt that is left in the mouth after you take your food is I'd call the fodder for the bacteria to cause havoc in your mouth, to cause cavities and cause the inflammation. So make sure that you brush to disintegrate that plaque that forms on the teeth. Once you remove that, you've already removed one of the components that causes cavities and gum disease. So just by brushing, right? Then the second thing is observe, good diet. So you ensure that you have proper nutrition, food, avoid too much sugars, because again, sugar is fodder for the bacteria to cause the cavities, right? So just try to do that. And again, we said, if you have to snack, just make sure that you brush. The other thing is keep hydrated. Just make sure that you have lots of water, during that time. Of course, it has benefits elsewhere, but also for your teeth, it makes sure that you have enough saliva. Saliva is a God-given toothpaste, right? So that saliva has cleansing ability, so it's able to clean your teeth and maintain the right pH and environment in the mouth. So therefore, you will not have a lot of issues. So make sure that you hydrate. Then the other thing is just make sure that you visit your dentist if you can, before conception. If not, then at least during the phase of the pregnancy, even if you're not in any pain, just go, let them have a look, then tell you this needs to be sorted now, and this can wait until you deliver. And then more than that, we have people we call community oral health officers in our facilities. These are people who are trained to give you advice. There are so many things, like you said, we've learned even from this small talk that we've had. There are so many things that people assume, including how to brush. So we have people who, when they visit the clinic, they'll be able to be shown how to brush their teeth and how to take care of their teeth, so that we have good outcomes. Yes.
Now, there's a question here. Is it true that a mother's oral health deteriorates because the baby takes calcium for her teeth? Her teeth?
No, that's a myth. That's a myth. The tooth is the only part of the body that does not, I don't know if it's the only, I think could be a few others, but I know it does not regenerate. So once a tooth forms, that's it. That's why you find that when you have a cavity, it does not heal itself, all right? But if you cut your skin, it will heal. If you cut your nails, they'll grow. If you cut your hair, it grows. If you fracture your bone, it will heal. But a tooth does not regenerate. So it will be the last place where the body tries to get calcium from. But since it happens a lot during pregnancy and calcium is in high demand, most people think that that's why they're having issues with the teeth. But we have already seen that the hormonal imbalance, dietary changes, all those things are the ones that are causing pregnant women to have issues with their teeth and not the other way around. Yes. So it's a big, big myth. I've even seen some celebrities, saying, "Oh, I lost this tooth because of my firstborn." Yeah. No, it's not true. Yes.
So I want us to do a rapid fire myth busting round. I'll say a statement and then you tell us if it's true or false, of course. Now, pregnancy causes tooth decay. That's the first one.
Yes, it's a fact because of the factors that we've talked about. But it is not for everyone. If you make sure that you take care of your teeth, like we've said, it's not a must for you to get cavities. But you are more susceptible to getting cavities when you are pregnant. Yes.
Bleeding gums are normal and should be treated during pregnancy.
It's a normal phenomenon. Like most people will experience it. Most of it, you don't need to have treatment because it's just physiological. It will go away after the pregnancy. But in some cases, once we review, we might need to do treatment. So for most people, if the oral hygiene is okay, the reddening of the gum is normal. But in some cases, it's because of a disease which needs to be treated.
All right. Teeth whitening is unsafe during pregnancy?
I would say yes, because it's a superfluous procedure, really. You don't need to do that when you're pregnant. Yes. So it's not recommended.
Okay.
Yes.
And oral health has no connection to pregnancy complications?
Well, that's a myth. It has, like we've seen, there are a lot of connections between the two. Yes.
All right. Now, is mouthwash safe during pregnancy? You haven't mentioned anything about mouthwash. Umesema tu maji.
Yeah.
And there's also another one. You said something that we put in water. Is it fluoride?
Bicarbonate.
Bicarbonate?
Yeah.
So is mouthwash safe during pregnancy?
I'll be very guarded, but yes, you can use mouthwash during pregnancy, especially now when you have gingivitis. That's the inflammation of the gum. Yeah, you can use the mouthwash. It's safe. Of course, you are using it and spitting. But like I said, it shouldn't be a substitute for brushing because that's what people do. Find that those people who want to be bougie, they don't want to brush. They just want to use a mouthwash. No, brushing cannot be substituted. If you're able to brush, brush. But for those ones who are unable to brush because they feeling nauseated, then they can use a mouthwash.
Okay.
Yes.
Are there ones that are recommended and ones that are not recommended? Because you see, there are mouthwashes that are alcohol. They have alcohol, a percentage of alcohol, and there are ones that are alcohol-free.
So the ones that we like is chlorhexidine mouthwash, right? So a chlorhexidine mouthwash, most of the time it's 0.012%. That should be sufficient because chlorhexidine is able to stay. It has what we call substantivity. It stays on the teeth for long and prevents, the formation of plaque and also cavities. So chlorhexidine mouthwash is good. Things like other mouthwashes are usually for surgery. So there are many brands. We are not going to mention any, but just a chlorhexidine-based mouthwash is good enough.
So PJ, we are wrapping up. Anything you have for expectant mothers in terms of their oral health care?
Yeah, so I think it's been a very nice episode where we have demystified some of these myths that are there. And like I said, information is power. And we've been able to share some tips of how to take good care of the teeth during pregnancy. It's a very important phase because for all of us to exist, it means there's a woman who went through that phase, right? So, and that's why we really have to take care of them and make sure that they, it's not a painful process. So take home is that it's safe to visit the dentist when you are pregnant. You need to take even more, care of your teeth during this phase of pregnancy, right? And number 3, that we need to make sure that we visit the dentist, at least once during the pregnancy, if possible before, but at least visit even if you are not in pain. And lastly, of course, we have a lot of, like I've said, we have our facilities in the county. They are public facilities. Some of the services are free, so they should not feel that they are financially constrained, and that's the reason why they're not going to the hospitals. We have a mother and child dental clinic. I think it's the only one in the country at Pumwani. It's going to be launched by the governor very soon. So they are well covered and they should visit that. Then lastly, of course, we could not cover everything. If anyone has any questions, I'm found on social media. Instagram is Dr. PJ Muriuki and Facebook is PJ Muriuki. So they can inbox, and when I get time, I should be able to answer their questions. Yes.
Thank you so much, Dr. PJ Muriuki, Director Dental Services, Nairobi City County, for helping us with this discussion. We take a break at this point. Fitness Thursday is up next. Stay with us.